headquarters of common sense.
Talk Radio.
Now, you are more concerned, I suppose, with the care business and the care workers who have lost their jobs already than the NHS workers who now may be able to keep theirs. This has been an extraordinary sort of episode, hasn't it? Because I always wondered if it was just Sajid Javid trying to get as many people vaccinated as possible, and that in the 11th hour they might just change their minds. But you're welcoming this anyway.
We are welcoming, yes. I think the first thing to say, Mike, is we're obviously very, very supportive of vaccination in terms of it being the best way to keep people safe. There's absolutely no doubt about that. But the issue that we're facing is that what mandatory vaccination has done to social care is compound a recruitment crisis that we were already experiencing in terms of the mass exodus of people from social care in November, on top of 100,000 vacancies already. So we welcome it because it will hopefully help to alleviate that situation, although much more needs to be done. But of course, it is disappointing that it has taken the NHS making a stand for social care to also be heard, when in fact we face the exact same issues around staffing and being able to deliver safe services.
Yeah. And do you think it was the sort of size, the sheer size of the numbers in the NHS that would have been affected? Because I think there was talk of somewhere between 75 and 100,000 people who haven't been vaccinated, which is a very small proportion of the NHS staff overall, but it's still an awful lot of people that you can't really afford to lose.
I think, unfortunately, it's more to do with how social care is positioned versus the NHS. In terms of social care has always been seen as a bit of a poor relative of the NHS. And, whilst we love and cherish the NHS, social care needs to be put on an equal footing in very many ways. The projections around a number of bodies were making around vacancies within social care as a result of vaccination were similar to the NHS. So, I think it's more about the loudness of the shouting, and also the fact that the NHS, it has been incumbent on all of us to protect the NHS through the pandemic, but unfortunately social care has been a bit forgotten.
Yes, well, quite. And it's been forgotten in various different ways. I mean, your organisation, which provides respite, is more of a kind of a part... No, I don't mean to say this in the wrong way, but it's a part-time respite for people who care for their elderly relatives or whatever it is over a long period of time, and they have a place to take them. But there's also individuals who go into other people's homes who are care workers who haven't been able to do that and who maybe have had to find other jobs. People obviously who work in care homes themselves. I mean, how badly has the business of care been damaged?
Very badly. I think we're facing a situation now where there are 400,000 people on waiting lists waiting for care. And what mandatory vaccination has done is mean that some providers have struggled so much to staff their services. Thankfully, we're not one of them, that they've literally had to close their doors. Yeah. And what that means in real terms is that people simply go without care. And that, quite frankly, can be dangerous. We have a very high rate of vaccination compliance, but we did lose colleagues through this process. And what that's meant for us practically is that we've had to cap the number of people that we can give respite to. And if you think that the majority of people are actually cared for at home as much as 24 hours a day, essential respite is a lifeline. And we are simply restricted in the number of people we can offer that to at the moment.
Right. And would you be in a position to offer any of those jobs back to people now? Because presumably, if it's not mandatory in the NHS, it's no longer mandatory in the care home sector, is it?
Well, it's subject to consultation at the moment, and we're not quite sure what that means practically. But the reality is that, yes, we do have vacancies. The bigger concern is actually that people have gone on to find jobs elsewhere. And, the other reality is that currently social care, because of the wage issue, is also competing with sectors like retail, who can simply afford to pay more. So some of our colleagues have obviously left social care, and it's whether people want to return.
Yes, quite. And so as far as the whole kind of business of social care is going at the moment, we're hearing that there's still quite a lot of elderly people as well in, you may not know the answer to this question, but quite a lot of elderly people in hospital beds who can't be released back into the care homes because there aren't enough people to look after them.
Yeah, that's correct. The NHS simply doesn't function without social care. One of our services at the moment is turned over because we can't deliver respite there, to delivering a step-down contract for the NHS. So we take non-acute patients out of hospitals in order to free up beds. And, once again, if the staffing crisis worsens, there's a risk of capping there. But you're absolutely right. There are care homes literally closing their doors who hospitals would rely on to take that capacity.
Yes, and it is a really worrying thing going forward. So how long do you think that process will take? I mean, if there are people listening to this who have lost their job but are hoping maybe to get it back, I mean, how long do you think that process will take? Hopefully shorter than the Metropolitan Police investigation of Downing Street.
We honestly don't know, because what we've heard last night, and as you know, it happened at sort of about 7 p.m.
Yeah.
So after we'd all closed our computers, was that it was subject to consultation. So at this point, there are quite a number of outstanding questions about what it means practically in reality.
Good talk. Hot talk.
Bold talk. Talk radio.
Listen on your smart speaker.
Watch it live on your smart TV.
The world headquarters of common sense.
Talk Radio.